Hey, this is Mathia Ford with RenalDietHQ.com, and today I want to talk to you about awareness and prevention of kidney disease. It's important to understand that you can be aware of your risks and that you can prevent the further damage that you could do to your kidneys by doing a few simple things, and I wanted to talk to you about that today. The risks of developing kidney disease are people who have high blood pressure, because high blood pressure over time can cause your body to do small amounts of damage to your kidneys, your small blood vessels. The blood pressure is very hard. The higher blood pressure is very hard on those small vessels. Same thing with diabetes. If you have diabetes, the damage that is done by those small blood vessels by the amount of sugar that's in your blood, the sugar can damage those little capillaries that are in your kidneys and decrease your amount of kidney available to filter your blood. Also, if you're overweight, it's a well-known fact that you have a higher risk of developing kidney disease, and that's probably related to the fact that you have a higher risk of heart disease and a higher risk of high blood pressure and diabetes. So all those things combined together don't make for a pretty picture. So there are things that are modifiable risk factors and things that are non-modifiable risk factors. Non-modifiable risk factors are things like your age and your gender and your race. So your age, your kidneys naturally over time have damage just because of how long we live. Your gender can play into that, and your race. Things that can be changed, like I just talked about, controlling your blood pressure. If you can control your blood pressure through the use of medication, through some exercise, through managing your stress, then you stand a good chance of lowering your risk over time of developing kidney problems. Also, controlling your blood sugar. As a diabetic, it can seem like it's not that big a deal if you have high blood sugars or if your A1C is over 8 or 9, but really the optimum level for people who have diabetes is to get their A1C down to between a 7 and a 7.5. And that seems to really help people not have as high risk of developing kidney disease. Things that can be changed also are stopping smoking. Smoking contributes to a lot of bad things, not the least of which is kidney disease, and probably contributes to high blood pressure. Losing weight, like I said, obesity is a contributing factor. So losing weight, exercise in general will help you control your blood sugar, your diabetes, and your blood pressure. Exercise is key. Doing small amounts, talk to your doctor, but walking 10 minutes in the morning, 10 minutes at lunch, and 10 minutes in the afternoon, 30 minutes a day, gets you a lot further along than you were without doing anything. Another thing that a lot of people aren't aware of is that medications can affect your kidneys. So there are some medications that if you know you're prone to kidney disease, or if you know you already have the beginning stages of kidney disease, that you should stop taking. And I talk about those in my book on Amazon called Living with Chronic Kidney Disease, Pre-Dialysis. You can go to Amazon and buy that. I think it's $2.99 at this time. And you can, that's on Kindle, and then there's also a paperback version. Early intervention is key. If you have any of the previously mentioned risk factors and you make changes now, one of the things that you're doing is delaying the onset of kidney disease. And kidney disease is a lot more restrictive diet than just a diabetic diet or just a cardiac diet. It's like those two together plus some. So if you're feeling like it's a hard time now managing your diabetes diet, kidney disease diet is like 5 other things on top of that. So what I want you to do is to prevent the development of a kidney disease that needs a special diet. So I'd like you to go and be proactive with your doctor, be proactive about asking for the medications and about asking for the lab tests that you need, about your glomerular filtration rate, GFR, and asking about how much protein's in your urine as a diabetic so you know what your risk factor is. You can, again, like I said, read more about awareness and prevention and also the stages of kidney disease and what to talk to your doctor about with relation to kidney disease in my book on Amazon called Living with Chronic Kidney Disease, Pre-Dialysis. And it's by me, Mathia Ford, and I'm a registered dietitian. And You can find more information on my website at www.renaldiethq.com. Thanks for listening.